Good afternoon. I do apologize for the delay, as well as the cancellations from this morning as well. Also, we will be discussing hard candy over Zoom. And while we are being recorded and this recording will be uploaded to YouTube, we are not live streaming this. So no Instagram today. We're just going to be solely discussing the film over Zoom. There are no medical students, so this is an opportunity for interns to actually come to the table and discuss their thoughts about what hard candy is really about. So if everybody could enable their video, and if they, I'll try my best to check the chat room, but otherwise feel free to unmute and discuss the film. We do have some people in person here. Unfortunately, you guys are going to really be pimped. I expect you guys to carry on the conversation since there are no medical students today. So everybody grab their notes. Kicking off the discussion, initial observations, where would you like to start? Hard candy.
I think that one of the I think that one of the things that stood out to me in the very beginning was that when Haley and Jeff meet in person, like not really one of the first things she says, but like she does tell him that she's like actually insane. And I feel like Jeff doesn't believe it until he actually sees it with his own eyes when they go back to his house.
So at least I'm foreshadowing. I'm not going to pretend that the writer director understood what that word means, but certainly consistent with the plot of this movie. How are we going to decipher? How are we going to define or choose to define insane? There's, I think, two areas that I really want to explore here that I think are major teaching points. I think number one, many people take that word to mean psychotic, that there is some breach in reality testing. And that breach usually comes in two common examples. Any guesses as to what those examples? This is going to suck for you guys, by the way, because I only could look at you guys. Now, again, please on Zoom, feel free to unmute. But my Night's Watch is really on the spot right now in the absence of the medical students. Yeah. Hey, listen. Well, welcome to the big leagues.
Decent psychotic, like
Breach in reality testing per the American Psychiatric Association can either be perceptual or communication. Right? Perceptual, two common examples. Actually, I shouldn't say perceptual, I'm sorry. Breach in reality would be perceptions versus communication. That's breach in reality. Examples would include hallucinations, delusions. There are your two common examples of breaches in reality testing. Communication can be verbal or nonverbal. So verbally, we often think of disorganized speech. Nonverbal, grossly disorganized, or catatonic behavior. All right. So again, breach in reality testing can be perceptual, auditory, visual hallucinations. Could be delusions. And then the other would be communication. That could be verbal, disorganized thought process, disorganized speech. Could be nonverbal, grossly disorganized or catatonic behavior. And all of the above, any of the above, are quote unquote psychotic symptoms. More specifically, they're positive symptoms of psychosis. The pathological presence of something that at baseline should not be there. Right? There's a single person in this room. Again, Zoomers have to actually take my word for it, in which you are not experiencing hallucinations, delusions, grossly disorganized or catatonic behavior, or even a disorganized speech. All right? The presence of those, the pathological presence, hallmark positive psychotic symptoms. All right. Unfortunately for us, that does not equal insanity. Right? Many people think it does not. right? Insanity, while often due to psychosis, is more of a legal term or a medical legal term. Legally, it just means that the individual was unaware of their behavior and its potential consequences. That includes murder and death. When someone pleads insanity, usually they try to show the evidence of psychosis and then connect the dots because of the perceptual disturbances, because of the delusions, because of the bizarre or disorganized behavior. They did not know what they were doing at the time of the act. Right. So they try to connect the dots, but that is not an automatic connection. That's something you have to actually prove in court. Not all psychosis results in insanity, and insanity can result from processes other than psychoses. Depression, anxiety, less likely, but it can be due to those as well. It would be very difficult for a person, including Haley, to mention that they're insane because it goes against the very essence of what insanity means.
I think it's also kind of something hard to own up to, honestly, like telling someone that you just met that you're insane, you know?
Right. But even if she were able to do that, the mere fact that she's able to say that about herself shows or demonstrates that she understands what she's about to do, which goes against the very fiber of the insanity plea, which is that the person did not know what they were doing at the time of the event.
And she clearly understood everything. Yeah.
So very, very difficult to understand what she really means here. I think from a writer-producer perspective, this is just foreshadowing. But from a psychiatric perspective, it shows that maybe she's much more cognizant than basically she's providing misinformation. Other observations.
What I found interesting was the nature versus nurture comment, and then him then explaining a very personal story from his childhood that involved some sort of sexual thing with his younger cousin and his aunt. That jumped out to me personally.
Yeah, and it's interesting that you bring that up because I see a very interesting parallel here in that just now moving beyond the conversation of insanity and just talking about mental illness in particular, just solely focused on mental illness. Does the experience somehow justify the act? Right. So again, this is kind of consistent with insanity, but now we're kind of moving beyond the insanity discussion. Yeah, Jeff clearly has a past psychiatric history of trauma. And from a psychiatry perspective, perhaps has the evolution of a pedophilic disorder as a consequence of that trauma, right? So again, we're getting into cause and effect, right? So there's an interesting parallel between the initial statement by Haley, that's the insanity plea, and now that what we're discussing pertaining to Jeff, and that is, I did this because of what happened to me, right? Now, again, a psychiatrist can render that opinion. It's difficult for us to hear it directly from the patient without the psychiatrist providing that formulation and thinking, is it real? Is he telling the truth? And if he's not, I mean, this is a person just lured a 14-year-old girl to his apartment. Even if it is real, can we still connect those dots? And if we do, what does that mean? Because there's a lot of controversy when it comes to pedophilia and pedophilic disorder, because it's one of the rare conditions in psychiatry that is both a mental illness as well as a crime, right? It's prosecuted by the criminal justice system as much as it is treated by psychiatry and psychology. So interesting parallel, because you can see these two characters, I mean, are kind of with the same logic, albeit in two very different spheres. If Jeff were in front of us right now, I think one of the things I would certainly bring up is, or at least inquire about, is whether or not he ever had any kind of intervention or treatment. Right? This seems to have been a while ago, about 2 decades ago. what, if anything, in the interim? I didn't pick up anything with regard to the script. And Haley's response is consistent, with what we just said, right? You're pathetic, does that give you the excuse too? Could that rationalize why? And it's a slippery slope. It does contribute to a case formulation, but outside of an office like this, and that would include a courtroom, does it hold water? And that's going to be determined on a case-by-case basis. Let's go off on a bit of a tangent. In what was often referred to, or what is referred to as the sexual disorders chapter of the DSM, now really 3 separate chapters. What are the titles? What are the headers of those 3 separate chapters in the DSM-5 that cover what we would refer to as the sexual disorders?
I believe one of them is paraphilic.
That is one.
Sexual dysfunction.
Good. Sexual dysfunctions is 2. And the third one is gender identity disorder.
Right.
Right, those are the 3. Formerly 3 sections of a single chapter up until 2013. But with the publication in 2013 of the DSM-5, the 5th edition, that is the APA separated them into 3 separate chapters. And paraphilic disorder would be part of what chapter? Gillian, I don't think they heard you. I'm sorry, Jillian. I would call you Gil. Jillian, I'm sorry.
For paraphilic disorder?
Perfect. That's the answer.
Yeah.
Exactly right. They didn't hear you in the room, so the answer is
sorry.
paraphilic disorder. So 100% right. So let's focus on these conditions. I think one of the objectives we should set for ourselves this afternoon is to be able to name all of the paraphilias or the paraphilic disorders. And I think we already reviewed this at the Q&A, or did we? We did not.
I don't think we did.
No.
I'm not familiar.
All right. So let me ask the group, how did you learn the planets of our solar system?
Acronym.
Acronym?
My very eager mother jumped straight under Ned's pillow when it was Pluto.
Please, a little louder then.
My very eager mother jumped straight under Ned's pillow, but pillow was Pluto, so it just jumped straight under Ned.
Even more controversy now, right?
Yeah.
Children Ned.
Oh.
Interesting. All right. If that is the case, what about your very eager father? Now I know what you're thinking. You're thinking, well, Mars, dude. I mean, what
Wait, can you repeat that?
everybody always talks about my very eager mother.
Yeah.
And this acronym has many variations, always about,
okay,
right?
okay, yeah.
So I've heard my very eager mother hundreds of times
Mhm.
and teaching this particular chapter of the DSM since 2001. Nobody ever mentions my very eager father. So, and the acronym, the answer to that is my very eager father surfs porn for thrills. And now you have all of the listed APA paraphilic disorders. Right? So we're just going to name them. We're not going to really get into much discussion about them. Let's name them in order. Right? My. Nope. Molesting would not be considered a paraphilic disorder.
Masochism?
Masochism or masochistic disorder. What's the difference?
I guess one of them has to cause some kind of psychological distress.
Exactly right. When it does not cause psychological distress, when we discuss the behavior, we're going to call it masochism. When that behavior does cause clinically significant distress or impairment in functioning, we're going to say that behavior now is disordered and call it masochistic disorder. So once we've established this now across the entire spectrum, and now when we say masochism, we'll know what we truly mean. So we don't have to repeat the big words, right? So moving forward, we'll just call out the behavior, knowing full and well, we're really talking about the disordered behavior. All right. I'm gonna ask you guys not to search these terms. I don't want anything getting on your laptops. No viruses. This is a no virus day. I don't care if you're on a safe search. I've just, please, I don't want Dr. Gelfand to find out that you got a virus because of me. Very,
Voyeuristic.
voyeuristic, perfect. Eager, E. Wish you guys could actually see the three in the room right now. I got one staring at me like there's daggers, and I got the other two who will not look up from their
I'm
laptops.
not looking up.
Is it exhibitionist?
Perfect. Mother, M. I'm sorry, father. We're talking about dad. Father, F.
Think about these things on a daily basis, so I
You-
really
you
have no
will.
idea.
Is it-
Your patients are, so you will.
Is it fetishism?
Yep,
Yeah.
fetish, good.
Mm.
Surfs, S. Right. The acronym is surfs porn for thrills. So surfs, S.
Sexual assault or something?
No,
Sexual harassment.
nope,
It wouldn't be sexual dysfunction.
nope.
Oh, it's the opposite. It's of what I said before. It's
is.
sadism.
Yep.
Mm.
Sadism, good. Porn, P. Is the paraphilia in the film.
Pedophilic.
Pedophilic. 4, F. What is frauderism? Frauderistic disorder.
Honestly, I have no idea.
Yeah.
It's rubbing up against an unconsenting adult. And then thrills, T. Transvestic fetish. Yeah, so for those that have taken notes, for purposes of the acronym, I would just recommend flip-flopping the two Fs in terms of the order that we discussed. Frauderistic disorder should be the initial F. And the second F would really be fetish. That instantly reminds you that the final T would be transvestic fetish. They're back to back. It's easy to remember. Any questions about any of these conditions in terms of what they mean? We're not going to really get into much more beyond naming them today. I think they're rather self-explanatory. Anybody have a question about what they would entail? It is important, again, to repeat that the behavior separates from the disorder, in as much as that the disorder must confer some clinical significance. Clinically significant distress or impairment allows the behavior then to be framed as a disorder, right? Number two, all of the disorders. Well, let me actually pose it in the form of a question, not that I think anybody's going to volunteer to answer. But somebody comes in and the reason for their psychiatric consultation today is cross-dressing. What do you want to know in terms of working up for transvestic fetish?
That's the one where you rub.
No, that's frauderism.
What's
Transvestic fetish
Started. Why?
Well, that's definitely gonna be asked. It's cross-dressing.
Oh, okay. What sex you're attracted to?
Could be, not really. I mean, that's certainly part of the eval, but not necessarily primary focus anyway, in terms of deciding upon the most likely diagnosis. What you're gonna wanna know is the why. Because for all of these conditions, and I only use transvestic fetish as an example, but for all the conditions, the individual's goal must be some sexual gratification. So whether you think it's a fetish, whether you think it's a transvestic fetish, frotteurism, voyeurism, anything we named, the goal, the reason for the behavior must be sexual gratification. And if it's not, we're not dealing with a paraphilia. Right, that cuts across every single one of these behaviors. And it's important because sometimes these behaviors present and it looks like, boom, hey, I know what chapter of the DSM we're in. So for instance, what if a dude is actually found in the bushes outside of a sorority, right? And it happens all the time. They're in handcuffs. They come to you. You're the evaluator. You're assessing them, right? Do you automatically go to voyeuristic disorder? It's going to be part of your differential diagnosis. But if they're actually peeking in that window for reasons other than sexual gratification, the answer is no. They rule out, right? So that's got to be their intent. Right? Questions? Back to Jeff. Right. So Jeff, we have diagnosed with a paraphilia. Is there anything else you want to know? You would ask Jeff right now if he were with us. It's kind of a trick question, so if that's a hint.
I mean, personally, I want to know a little bit more about the caregivers rather than the aunt. So I'd probably ask something about like his father and his mother and the relationship between them.
Right. Family dynamics, right? Developmental history, absolutely. Anything else?
Like what he was like in school when he was younger, like if he showed any potential signs of like a pedophile when he was older, you know?
Okay. So again, developmental history,
Yeah.
sure. I think what I'm getting at is that if first of all, Jeff's not going to present with a chief complaint of pedophilia. It's very unlikely
Yeah.
the reason why he made the appointment is going to include blank.
Like he wouldn't confess that,
No.
you know?
Not to the person answering the phone, taking appointments for you,
Mhm.
right? It's likely to be, if he was able to survive that roof, I want to make an appointment with Dr. So-and-so for anxiety. Right, that's likely to be the chief complaint here. You've got to be the astute clinician and get an idea of what's really going on. And hopefully you're not going to just work him up for panic versus OCD, checklist of symptoms across the board, decide, well, this seems like one of those, and here's your SSRI, right? Because you're going to miss a lot. That said, what if upon your evaluation, you do get information that's consistent with the script of hard candy, and along with whatever anxiety disorder you might or may not diagnose, you also now have another diagnosis called pedophilic disorder. At this point, what is the next step? Other than safety, of course, suicidality, that's always the next step. But after establishing safety, it's going through the acronym. My very educated father serves porn for thrills. And the reason why is that once that astute clinician have uncovered a pedophilia, on average, individuals have 3 to 5 of them. So this is no time for a victory lap. Nobody's patting themselves on the back until you go through that list, right? A person who is able to rule in for one, on average, will rule in for 3 to 5.
So what other ones do you think Jeff has under?
So that was my question to you. Any evidence in this film to suggest that there are others involved other than pedophilia?
I was thinking about voyeuristic, maybe.
What gives you that impression?
Largely because part of his the way that he handles this is regarding photography and kind of the exposure of his subjects for his pictures. So maybe that.
That would absolutely be at the top of my list. Yeah. Is there a reference to having a hidden camera at all in this house? It's something that came across my mind. Would it surprise you?
It wouldn't surprise me,
I mean,
but
they-
I don't think that in the film is specifically.
No. Yeah.
I mean, because Haley was like tearing everything down, like destroying the paintings, like the photos and stuff, so I wouldn't be surprised if she found one battle than she did.
That would definitely be at the top of my list. If, again, telling one of his models to, go into this dressing room and put this on. I'd be actually surprised if in looking into that changing room, there wasn't one. So yes, that's at the top of my list. Any others? And again, they're all on the table. We have to ask for every single one of them. So remember that acronym. I'm just asking if there's anything in the script, any scenes that are strongly suggestive of where you might go first if you didn't follow the acronym in order. Which you should, because it's a damn good acronym. So there's two more. One I think is fairly straightforward, which I'm going to share with you now. The other one is a little bit more complicated that I might actually be discussing later on today. And if I do, I'm going to ask the Night's Watch group to bring to the Q&A. You'll have the answer. Right? So, but the one I'm almost certain he has a fetish. I mean, he kisses Haley's feet. So
I thought that was a joke, like in the beginning of the.
it's a joke until it's revealed that the dude is
True.
a pedophile. All of a sudden, joke's done.
Okay, that, yeah,
Makes sense.
yeah.
So 3 to 5. So I think we have 3.
Yeah.
If not 4.
Oh, you mentioned when he got tied up, he was like, when is it my turn? So isn't that an indicator of another finish?
We have 5. Yeah, it's building here. Yeah. Yeah. Yep. All right. So I think Jeff's behavior is consistent with the medical literature here. Other thoughts about Jeff?
Something with other diagnosis or anything?
Anything you really want to talk about?
What's her name that kept getting brought up with the email?
Oh, Janelle, right?
Yeah,
That-
that entire situation is very interesting. He just got buried in North House and was brought up.
Cause it's not like she was also like. She was like his age, right? It's not like she was younger. Correct. 'Cause she
Right.
could drive, yeah.
Yeah,
Yeah.
I assume that, yeah.
Because when it came down to either him getting tortured or her sending the email, he was just like,
Yeah, and same with like, when Haley gave him the option, she's like. You can either hang yourself or I can like. You can either hang yourself and I can like make all this stop or something, or Janelle finds out like what you did and everyone finds out. And then he didn't want her to know, so he just ended up like taking his own life.
Yeah.
But you think that he died, like you don't think he survived that, correct? Or do you think there's a,
I don't think you survived.
yeah, okay, yeah.
No, so I think this would be something that is highly consistent with what we would expect in clinical practice. It's a reason why we always talk to the family, because we never get the full story from the patient's self-report. And especially in situations like this, I mean, generally speaking, when it comes to mental health, we often find, and this is something that's cultural, that sharing such information is just qualitatively different than sharing physical health information. And the healthcare system treat that the same way, and quite frankly, to a point where it's almost prejudice, right? I could easily access anybody's note when it comes to the heart disease, but I have to quote unquote break the glass in the electronic medical record when it's mental health, right? So it's definitely treated differently, and we see that even reflected in patient self-report. And not every mental illness is built the same. And certainly the paraphilias are at the top of the list or bottom of the list, depending on how you form your list, when it comes to sharing. So I would not expect his girlfriend to know these things. He certainly makes concerted effort to ensure, at least per Haley's reassurance, that she not find out, that she not find out. And I think that's very, definitely Hollywood and over the top, but certainly consistent with what we find in clinical practice very frequently.
With that, do you think that Jeff killed Donna, or do you think that Donna killed herself? Because he was saying that, so Donna was the one that was missing. He claimed that he watched Donna kill herself along with the person that he was with, Aaron. But then Haley was saying that she talked to Aaron. Aaron said that, I can't remember if she said that. Either Aaron said that he watched Jeff kill Donna, or I don't even remember how the line of that went, but what do you think happened with that? Like, do you think he had something to do with her disappearing?
Yes, that's a great question. So, I almost, again, I think in clinical practice, the one thing that you see more frequently is that the young girl takes her life because of the sexual assault. And it being her fault, and her not feeling safe at court, it going to court, her sharing, her being ostracized, blaming the victim, all of that, resulting in what we see very often, especially now with social media, suicide. So, no, I think, and again, I think from a producer's perspective, I see a parallel between the characters of Donna and Jeff that both die by suicide. Then there's that irony there. So that's where I think it fits best. But I also think it's intentionally ambiguous. I think part of me wants to think that, because then it does, and listen, Haley's not perfect, but she does have a little bit of a larger superhero cape if she's responding to her friend's suicide.
Mhm.
Other thoughts?
I thought it was interesting how Haley was always one step ahead of Jeff. Like, when she said, "Oh, I'm going to take a shower," and he like took the knife and like went into the bathroom to find her in the shower, but she already had like the water running and then had like the stun gun, so she was like ready to attack him because she knew that he wasn't gonna like stay put, or he was gonna try to hurt her. And I think that her being 14 in that position, I think that's like, I guess I would say like impressive that she was like always one step ahead of him and she always had like the next move planned, you know?
Let's talk about that a little bit. What about that?
What
I
about
mean,
that?
I think there's two ways to approach the question. Because while I think when you're sitting in the movie theater and you see this, you're ready to cheer.
I think that Haley knew that something was gonna happen to her and that she like automatically knew that.
How did she know? I totally agree with you. I was just gonna say the exact
Like,
same thing.
I mean, when she meets him and he's like, what, like 30 years old and she's 14, like she knew that like he was a pedophile. So I feel like she had prepared to defend herself.
That
You
was
know,
his first time either. I mean, he took girls to the same old coffee shop. He had a gun. It just seemed like he was very strategic, so she had to be obviously like
one step ahead, yeah.
So I think there's a nice parallel here with regard to the different directions we can take right now
Mhm.
with Jungian theory. So this is going to come out of left field initially, but I promise you we're going to land right back up in the same ballpark. Give me your quick synopsis of the theory of Carl Jung. So he agreed and disagreed with Freud. He agreed with Freud in that we, of course, have a personal unconscious. We have an unconscious component of our central nervous system, our brain, which is formed through our personal experiences or early childhood experiences. Freud said that, Jung said that. Where Jung differentiates from Freud is that he also believed we had a collective unconscious that was genetically inherited from our ancestors. So I think there's an interesting, it's not symbolic parallel here. She is one step ahead of him for perhaps two reasons. Number one, as far as collective unconscious goes, her hypothalamus is taken over.
Mhm.
You know, when she's researched him, when she's premeditated this, when she's planned this, her hypothalamic function of fight and flight were part of that process.
I would say it's definitely part of it, right, in that situation, like, she ran away, but she also like did fight him too.
That's collective unconscious. On the other hand, maybe there's also a personal unconscious in as much as she's been molested before. A man has done this before. A man has ran into the bathroom after her before. And she's learned from it. So there's a couple of reasons why she is one step ahead of him. This is called precociousness. This is not normal for a 14-year-old. And while in the theater, we're ready to jump up and cheer her, in a clinical situation, we have questions to ask here. Because this is a sign of mental illness. This is a sign of maybe not mental illness per se, but certainly trauma that certainly can increase risk for mental illness. This is not normal. That's precocious behavior. And from a Jungian perspective, I think it has both personal and collective components. Other thoughts here?
I think there's support for that also. Like I know that it was kind of trying to show like how manipulative and in control she was in the moment when he was like, oh, like, aren't your parents gonna be worried about what time you're coming home? And then she was like, oh, don't worry about that. And then he tried to like psychoanalyze her almost. But then like it turned out to be like, oh, got you, like you weren't actually psychoanalyzing me. I think that could also kind of be a nod to her having this experience of trauma at home. And even though like she worked around that whole like interaction in her favor, it could still hint at her like skills and ability to be on top of everything being a result of some kind of trauma or neglect that she has in her own life or home.
Yeah, I mean, again, 14-year-olds do not set themselves up as potential victims to catch predators. Irrespective of how close she may have been with Donna. There's a lot here to unpack. And as a psychiatrist, as a psychologist, we always talk about earlier experiences, and it's always going to implicate mom and dad and the family. Yeah, I agree.
Another thing that was interesting to me is how he said to her, "You're going to regret this later on in life." And then she turns it back to him as like, "Well, didn't you like regret what you did to her? Like, isn't it haunting you?" And that was just another thing that was interesting.
Yeah. Again, we probably could examine his behavior across the spectrum of Kubler-Ross's stages of grief. Right? He starts out in denial. Oh, this is timing.
Yeah,
Right. You know, there's certainly bargaining, there's certainly anger, depression, and then the final scene, acceptance.
yeah, he kind of just gives up and that's when he like ends his life, because he knows that he really can't get out of what happened. And I thought it was pretty interesting also when after he jumps, I don't even know, she's like, or not, like, or I'm not helping you, or I don't even remember what the last line was, but like basically saying that like she's not gonna help him because he's dead, and like what can you really do about that in that stance?
Oh yeah, I think she never had.
Yeah, I really don't think she had either.
No.
Especially because she kept like she would act all like vulnerable and sad, and then she'd be like, "Oh, you actually believe that?" You know?
No, she never had any intent to keep any of this from Janelle.
Yeah,
Janelle was gonna find that either way.
yeah,
Yeah.
And then Janelle probably like, if the movie extended, she would probably have seen it there. You know?
Not only seen there, but
Seen
all
the whole thing. Yeah.
whole thing happened. She's gonna get photos. She's gonna get everything that
Yeah.
Haley collected. Yeah. So anybody here ever watched the movie Saw or any of the Saw franchise? That's a quick no, by the way.
That's the most recent one. I think it is.
Are you? Yeah. No, it's I'm not gonna, no spoilers, and I'm not gonna really get into this because if I go off on a tangent, yeah, I can actually take us through tomorrow. I'm a big Saw fan. That said, there is a nice parallel between these two movies in as much as John Kramer, who is Jigsaw, certainly is a notorious serial killer with some bizarre moral code, right? If you are able to withstand incredible pain, perhaps even torture, you have an out. You're not going to die from his trap or in his trap. Your choice, if you choose not to cut off your hand, not to stick the needle in your eye, whatever it is, truth or dare kind of thing. There's only one other outcome, and that's your death.
Mhm.
So, and the idea, and he said this more than once, you grow from this experience, right? And it's just like Fight Club, right? When Tyler Durden had the gun to that one person's face in the beginning of Fight Club, I think he dropped out of medical school, and was told, tomorrow you reapply to medical school. And after this near-death experience, tomorrow you'll breathe air it's going to smell the best you've ever smelled, right? New lease on life kind of thing. Same thing with John Kramer. There's this moral code. All that said, Haley does not have that moral code. Haley is actually counter to that. She's going to murder, or she's going to send somebody to his suicide. However, she's not giving him an out, right? She says she is, right? She's bargained with him. If you jump, Janelle will never find out. She never had any intent of that. Haley's counterpart in the Saw franchise is Amanda, right? Amanda is the accomplice, but Amanda is also the accomplice, the mentee that goes rogue because she just gets the thirst for serial killing and she blanks the moral code. Questions about Haley, or Jeff for that matter? Other thoughts here? The other kind of cool thing about this movie, and kind of wrap up with this one, there was I don't say a mistake, but there was just an incident or a coincidence that actually turned out to be quite fortuitous for the writer-director. Haley's character was not necessarily scripted to wear anything in particular. There wasn't like she had a true wardrobe, it was very loose. It was the actress's own choice to wear that red hoodie. And as a result, this movie then pivots to be an adaptation, a modern adaptation, not only of Little Red Riding Hood, but the Little Red Riding Hood mythos, where the little girl meets the hungry wolf. The themes share very, very easy, but very few would have actually made that connection if not for just the circumstance, the happenstance of the lead character choosing to wear a red hoodie. That hoodie could have been just as easily blue or green. So not necessarily a mistake, but just a coincidence really allowed this movie to take a little bit of a different direction. Which is interesting because there's another movie called Hoodwink, which is yet another, albeit CG animated adaptation of Little Red Riding Hood, in which Red got something to her. Maybe not at the level or the pathology as Haley, but certainly not just the victim either. Final thoughts. Alrighty, let's log off. Give us 5 minutes. We're going to log right back on to talk about a couple of patients. We're going to provide the clinical case conference in a little bit different format. Discuss that further in about 5 on our established link. So everybody else back there then.